A fortnight ago, Kaleidoscope featured Natalie Soiza on Ceylinco Live Let's Talk. Natalie, a photographer, was undergoing a double mastectomy at the time, and we are pleased that she's recuperating well. Also, she had a ray of sunshine after her days of doom and gloom, when one of her photographs was chosen to be exhibited in the United States in the Eyes of Main Street Festival. With October being Breast Cancer Awareness Month, I had a chat with Dr. Shereen Amarasekara, a volunteer at the Sri Lanka Cancer Society who has a master's in community medicine and has worked in New Zealand, especially in cervical and breast cancer screening programs. I asked her, what are the first signs of breast cancer?
I mean, if you get a painless lump, which may or may not be attached to the skin, or skin discoloration or puckering of the skin, or even retraction of the nipple with a bloody discharge are some of the signs of breast cancer.
So what should women, and men of course, be aware of? Basically, who is vulnerable?
In men, breast cancer is not as prevalent as it is in women. And in women, there are a number, as I said, a number of risk factors. One is alcohol. There's alcohol, obesity, then prolonged use of the combined pill, hormone replacement therapy. Those are a few risk factors. If you have a family history of a mother, sister, maternal aunt who have had cancer, that increases your chance of having breast cancer.
How often and at what age should we get tested?
We would recommend is that from the age of 20, you start self-examining yourself so that you are akin to the changes in your breast, and you would be able to pick up a lump much faster, or if there's some difference in the appearance of your breast, you'll be able to pick it up faster because you've been doing it longer. For mammograms, which is the international screening method, we recommend from 45 to 69 years, right? We recommend that a mammogram is done every 3 years. After 69, after 70, it's done at the recommendation of your doctor. However, again, if you have a family history of breast cancer, we recommend that from the age of 40, you start getting a mammogram every year.
While there is focus on the patient, the carers who look after and are around the patient with cancer generally get minimum attention. Whether it's a spouse or a parent, life can get pretty tough for the carer. How do they cope? Gerald Saram was hit out of the blue when his wife Kisani was diagnosed with cancer when she was just 45. His son was 12 and his daughter was 15. In just 6 months, she passed away. This was 3 years ago. Gerald goes over that time with me. Gerald, what did you and the children go through while looking after Kisani?
From the time she was diagnosed to the time she passed away, it was only a matter of 6 months. So, but in that 6 months, it was very intense and very, it was telling on the children. And, you know, personally, I had my own health issues which I had to deal with at the same time. My son got dengue at the same time, so everything came in all at once. So it was very, very intense. But we managed to muddle through, and we had a lot of support. I had support from my church group, the Rotarians that Kisani was a member of, the Rotary Club. They were very, very supportive, not only of me, but also of the children. Everybody just closed ranks and gave us a lot of support. So what I would encourage amongst people who know other families that have had to go through this trauma is that they do likewise. And it's not just a question of picking up the phone and saying, "Hi, how are you? Is everything okay?" I mean, I think if you're genuinely giving help to a family like this, you need to go out of your way, visit them, take the kids out, you know, for a movie, that kind of thing. You know, it needs to be hands-on. One word of advice that I would give to any spouse, if be it male, female, whatever, but any spouse who survives the other, and who has small kids, young adolescent kids, is get as involved as you can with any other activities. Don't not be busy.
What's the biggest lesson you learned through this whole process?
You learn to cope. You learn to get on with life, and if you're someone who's tending to get into depression and all that kind of stuff, don't get busy, and don't think negatively about it. So that's one thing. Secondly, it's the resilience of the kids. It's actually amazing. The moment this happened, they just banded together, the siblings came together, and they've actually been an inspiration for me. They gave me a focal point in my life that I needed to provide for them, and not roll over and give up in front of them. And I don't know, for whatever reason, they've not given up on life either. They've just carried on.
Sanjini, Shehani and Johan's mum had cancer for 20 years, while their dad had pancreatic cancer, though going through it for a lesser number of years. But the toll of looking after not just one patient, but two, was truly unimaginable. Sanjini, what did the family go through while looking after your parents?
One of the bigger challenges at the start, in '96 when mum was diagnosed first, was the financial pressures that we went through. But thereafter, it was all about how do you juggle. Every day is different. Every time she got out of it, it was different. So how do you juggle all of that? How do you give her the support that you are supposed to give, not fall apart, be strong, be objective, not get emotional? Those were some of the challenges that we had.
So what's the support you got, or what support would you have also liked to get?
We had access to this lady that talked us through some of the things that were going to happen. There was a doctor, a friend of my brother's overseas. She would tell us what was happening next, which is something that we didn't have access to here, because we don't know what to expect. You are overwhelmed and you're frantic, and you don't have somebody talking you through the different stages. That's the support that we got from two people overseas, and I think that we are really grateful for that. Also, your immediate ecosystem. So there are times that you can't really be hands-on. You need people, and we had a lot of support from our friends, especially from my dad's bosses. They were fantastic, from financial all the way to emotional support. Family who were there on call at any point. So that's something that we did get, but something that I think that we lack solely here in Sri Lanka is counseling, access to good counseling, looking into that whole concept of wellness, because it's not just about the disease, it's about how do you cope with it overall as the person who's going through it, plus also the family going through it. How do you cope? What is it that you cannot do? How do you do things? What's the infrastructure that's available? Those are things that we don't know.
What advice would you give others whose parents are going through the whole process of cancer or have been through?
So you have to be really patient. There are good days. It's like you wake up every day going into battle. You can't get angry. Because the patient is going through multiple emotions. They are going through depression, they are going through insecurity, they are not sure if they're going to be dying tomorrow. So all of that combined, you have challenges in dealing with them. So you have to be really, really patient. You have to read up, you have to know what's going on. You can't pretend that you don't know, so you have to check on the medications. I used to have a list, and I used to check every single medicine, counter check it, check the side effects of what's happening, so that I can be prepared, and my brother and I could together deal with anything that was coming to us. So that is something that I think we have to be ready for.
So what's the biggest lesson you have learned through this process?
Resilience, because it's different each time, each day it's very different. When mom got sick, we thought dad was going to go down the same road, but his illness was more intense and shorter period. Mom would look at it like she was a champion. But I think that's what I learned, looking at her, her faith, the fact that she was able to smile through everything. So that's something I learned personally, and that's how I anyway deal with life.
While thousands more families are going through similar experiences, some more harrowing than others, the Sri Lanka Cancer Society, while doing immense work in increasing awareness of cancer, also has the 32-bed Shanta Sevana Hospice for terminally ill cancer patients and the 83-bed Bandaranayaka Memorial Cancer Homes for transit patients receiving treatment at the Maharagama Cancer Hospital. The Society also provides a lifeline to 125 needy patients released from hospital with monetary assistance to purchase drugs and gain self-sufficiency. And of course, to do all this, donor funding is very important, as it takes about 75 million rupees to do all this. So any donation is most welcome. With that, I say thank you to our guests on Ceylinco Life Let's Talk, Dr. Shereen Amarasekara, Gerald Saram and Sanjini Munaweera.
With Ceylinco Life Pension Saver, Sri Lanka's premier retirement plan, start planning for your retirement today. Ceylinco Life, a relationship for life.